But sometimes it is unexpected, like a water break.
Hello all, welcome to BirthVibe, podcast by Rainbow Children Hospital. Today we are going to discuss about preterm babies, what it means to the babies, the families and us as healthcare professionals. I am Dr. Manjunath, I am a neonatal consultant from Rainbow Children Hospital, Dr. Shefali Tyagi, our obstetrician from Rainbow Children Hospital. As we start off with Dr. Shefali, parents, when they think of to have a family, a baby, they would be expecting to have a normal, healthy term baby to go home. However, we know preterm birth is at risk. And arguably, India is also have got a high preterm birth rate.
That's true.
Around 1 to 2 per 10 babies are delivered preterm. What steps can the couples take even before they think of family, so that they're prepared to reduce the preterm labor?
So that's a good question. So once we think that preterm, we think only in terms of pregnancy, but actually the preparation starts pre-pregnancy.
Sure.
Now we generally get so many couples who will have, they would have no clue that they are having a high sugar. When we routinely do a HbA1c, it comes out to be 10, 12. Some people will be on BP tablets, which are not like pregnancy friendly. So many medical conditions can be there. But they come first time during pregnancy when things are already, in motion. Baby is already subjected to those medicines. So the first step to prevent preterm is to come pre-pregnancy for a pre-pregnancy counseling. We have had cases where there were mid-trimester losses. 20 weeks, lost the baby. 22 weeks, stitch put, lost the baby. And then still they come in pregnancy with the third pregnancy, okay, what can be done? So if you're talking about abdominal cerclage, it should be best done pre-pregnancy rather than when the patient is pregnant. So the correction of the medical conditions is very important before the pregnancy, so that we know that the BP, sugar, etc., if they have any other medicines like, this epilepsy medicine or any other, so many conditions are there. So that has to be optimized for pregnancy first. And that helps the couple to have a better outcome during pregnancy and delivery. So the first step, I would urge the audience to kind of have a pre-pregnancy counseling to the gynecologist, so that you can understand what is your medical condition and whether any steps have to be taken to improve it.
I think that's a very good summary, thinking about quite early, looking after their general health and seeking pre-pregnancy counseling. That's very good. And now, our job is day in and out looking after these babies for you, the pregnant mothers. And they come into your clinic, they would not be having any idea there could be a preterm labor at that time as well. And are there any steps or measures you can take to assess during the pregnancy if these couples are at risk for preterm labor, or what steps do you take to assess them during the antenatal care?
Preventing preterm labor is a teamwork. So like obstetrician, neonatologist, plus fetal medicine specialist, nursing care, everything kind of pitches in. So during the pregnancy, we need a proper antenatal care to kind of see that whether the lady can kind of go into preterm labor. Some preterm labors can be anticipated in the sense if she's already on BP tablets, which are going, on the higher dosage, we can anticipate that she might start having higher BP in third trimester and we might have to deliver. Okay, some women are more susceptible to develop preterm contractions and all previous history. And we know that, okay, there is a possibility that 32, 34 weeks her labor can start. And sometimes it is that once we are doing the ultrasounds and we see that Doppler changes have started early, let's say 22, 24 weeks, we can anticipate that, that we might not be able to reach till 37, 38 weeks. We might have to take a call in between. So these are sort of anticipated and we can be little ready, the couple can be ready. But sometimes it is unexpected, like a water break. Suddenly the water breaks and you go into labor and, then it is unexpected that lady did not expect that 28, 29 weeks her water will break. Or sudden very high BP out of nowhere, which was not anticipated or which was not there in the system. So these things can be kind of little challenging. So if we have a good antenatal care, some things we can prevent, because if we know that Doppler changes are there, we can kind of monitor further, take precautionary steps so that we can pull the pregnancy as long as possible.
Sure.
But sometimes we are forced to still go ahead with preterm, like water break, the pain starts, not able to kind of hold it back. So in that case, we need your help.
Yes, sure. Yes. So we pitch in at that point of time.
So I wanted to ask you that, this, when the people come in, go into preterm labor, so it is little challenging for the obstetrician, challenging for the neonatologist. And like, suppose I have a 23-weeker and suddenly she has broken her waters and she's into active labor and I take your help. So at what point would you encourage them to go with NICU care or a comfort care? Because for us also to say, okay, whether you should go and deliver and not do anything about this baby, or whether we should try and, do everything for this baby. So how do you decide? What are the criteria?
It's a very good question. I would also say a golden question. The reason is, what is the periviable gestational age, and when we as a neonatologist or as a perinatal team can get involved with the care of these babies. For me now, I've been more than in 2 decades of neonatal care, and my perception has also significantly changed. 25 years ago, while I was in India, my hope for less than 32 weeks was not so great. And since then, I've been in UK for a reasonable length period of time, and we have been involved with 22 plus 5 weeks onwards. Even there, the goalposts have been reducing since I've been there. We were more actively getting involved with 25 weeks when I started over there. This was around 18-20 years ago. And then that has been moved to around 22 plus weeks nowadays we are getting involved. I think for all of this, the most important, as you earlier mentioned, is having a good perinatal team. Working collaboratively with neonatal team, working with obstetric team, fetal medicine team. There is no, in India per se as cutoff, but having a good perinatal team, as I said, like Rainbow, would help us to look after extreme preterm babies. What I mean is, when we say extreme preterm baby, we are talking about less than 28 weeks. And even with a good corporate sector, we have been able to produce good outcome for 25, 26, 27 weeks. Recently, we discharged a 25-weeker with 475 grams. And bless, apart from the lung issue for that baby, rest of the organs were intact. What I mean is no currently concerns. But all of these babies would be followed up in our follow-up clinics. Now, how do we approach this situation? If you ask me to speak to a 23-weeker, again, as I said, this is a holistic approach. I have to go with the parents with whatever I know as a hope, but also whatever I know as a challenges. And sometimes parents even with 23, 24 weekers have asked us to assess the baby at the time of birth, and then getting again involved with them, to see what is the condition of the baby at birth, and then to take further steps accordingly. So this is quite a challenging situation for professionals, and more so importantly for the families. Correct. And I think it's a good holistic approach. Regular talking to them has helped them to overcome these difficult situations. And going with the Rainbow, my colleagues talked about from Banjara Hills having a discharge, a 375 gram.
Oh, that's wonderful.
Yeah, so now we are much more optimistic for babies even less than 1 kilo. 600, 700, 800 gram babies, we have been able to give reasonable good outcome. But again, this is a very difficult journey for the families. We have to take them through this one on a discussion with regular basis. Having discussed about the perinatal, how do we counsel, as we are doing all of this, Dr. Shefali, you would be also trying to prolong the pregnancy as much as possible, because we all know that mother's womb is the best place until they reach the term, sort of things. What steps or measures you can take to prolong the labor?
Right. So basically, it also depends on the situation by which we are anticipating preterm. So there was a case the other day, 32-weeker with Doppler changes, and somewhere outside they were told to kind of operate immediately within next 12 hours. So I had delivered her first and she came back to me, and then we started monitoring the Dopplers. So Doppler changes were there, but not to the extent that it needed immediate delivery. So we did kind of monitor her quite a bit with like regular NSTs and every other day Dopplers, but we could still pull her for 3 more weeks.
Right.
Okay, so she reached 35 plus weeks and then she could have a vaginal delivery as well. And baby did not stay in the NICU for a long time. So that is one thing, is that intense monitoring with a good backup team. Like I said, that fetal medicine is very important. Second thing is that sometimes it comes that, people come with PPROM, their water breaks, and they are still like 27, 28 weeker. So sometimes we try to hold on with intense monitoring. They are kept admitted. We keep a check on the infection, etc., how the baby's, overall NST, etc. is there. If required, antibiotics are given. So one case we could pull up to even 7 weeks.
Well done.
So she broke her waters at 23 weeks and she delivered almost at 30 weeks. So from 400 grams, baby reached 1.2, 1.3 kg, and then that baby we have sent home. So the effort from the team is there not to rush into delivery, because we get referrals from outside saying that she needs to deliver today only. And then when we try to hold, people's question that what is happening, we were told delivery today, but then they realize that each day spent in mother's womb is like, many days cut off from the NICU.
NICU.
So the effort is to try to prolong as much as possible, making that baby remain safe. Sometimes we are also forced to deliver as soon as possible if it is dangerous for mother or baby. But in many cases, we have been able to pull these preterms to few days, few weeks, which helps us to give time to, make things better for the baby.
No, I think it's good, as you summarized. Any hour or any day spent in the womb is amazing. And as you rightly mentioned, having a good perinatal team, calming the parents, that's all what we do in and out, because they come with so much worries to your clinic, because somebody has already told you have to be delivered, and they rush into us. But then going through the process, stepwise process, and reassuring both the families from that point of view is very good. However, we need to deliver, and we do get involved in those from neonatal point of view, because either the concerns are to the fetus too much or to the mother is too much. And then, we as a perinatal team would take steps to give a better outcome for this baby soon after birth, as well as for longer term. Can you go through those steps, what you would take if it is inevitable?
Once we anticipate that, preterm is inevitable, then one thing is to give steroids to the baby so that the lung maturity is better. And then neuroprotection is also advised. So magnesium sulfate, etc. can be started in anticipation before only, so that baby doesn't have too much of brain damage because of prematurity. And keeping an eye on the infections, obviously, so that also helps. So once we know that this baby cannot be kind of kept further in the womb, then these steps are taken to steroid the baby and to give neuroprotection, and then to involve you and have a planned delivery where the full team is there, either in the OT or neighbor room, with all our gadgets and, to help out the baby with the first golden hour to give whatever best support. Once we give those small babies to you, now what do you think is the biggest challenge that you face in these extremely preterm babies?
Very important question. Challenge for us, for all the professions involved, as well as for the families. We having a good perinatal team will help us to anticipate what are the problems and challenges. And in those first few days is to assess how stable we can get these babies to. And when we talk about prematurity, all the organs are there, but they're premature, which means they would need some support for some of those organs. In those first few days, it is good to provide a good thermal care, temperature, maintaining the good temperature, maintaining all the basics in a good situation, because these are all paramount importance from that point of view. And in those first few days, what's happening with the breathing support, how much they are needing, are we able to stabilize, not to escalate? And also in those first few days, there is a big change from what would have been happening in the womb when they come out. How are their heart rate maintained? How is their blood pressure maintained? All of that good stability with a very close monitoring would help us to reduce the complications of the newborn babies, particularly with those preterm, because they've got fragile blood vessels. Sometimes they can bleed. But having again the good perinatal team would help us to anticipate this and to prevent. However, with some of our very high-risk babies, if that happens, then also to support accordingly to prevent the complications as much as possible. Also, the challenge in those first few days is how the parents are taking all of this. Because as you in the very beginning mentioned, if this was something they had anticipated, they're already in that one. For sometimes what happens, they're just walked in, they have been delivered. There is so much, stress on them, quite anxious on them. But we do counseling quite regularly, and all those time spent with those in those first few days will help them to deal with the situation. One is they can with anticipate, because I've spoken to them few times, and also to know what's their hope for them, and also to know what the challenges we are facing, they're also aware of. So it's a quite a difficult journey, but taking with our professional experience, having a good team would help the parents to reduce as much stress as possible.
Right. So when they come back and sometimes show us the baby after 1 or 2 years, it is so, heartening.
Yes.
So
yes.
that is like very good movement.
Moment.
So when you send these small babies home, you'll have a regular follow-up with them, because then we lose the touch. Occasionally we get to meet the parents, but we don't know the outcomes. So over your experience, what do you feel is the outcome? How do you feel that, they do well later or not do so well, or what are the challenges?
Yes, some of our babies have spent quite a lot of months, a few months in the unit. Recently, we had a couple of babies who had spent around 100 days, celebrated 100 days with us, but they were born extremely preterm and they were also small. So by the time they reached, it was around 2 kilos, just short of 2 kilos when they went home. And, I always say babies are quite robust, because still there is a cross connection happening with the brain. So still these are all developing organs. And how to know their outcome, how they're doing in year of age, 2 years of age, preschool, and during the school. What does it mean for their when they are adult? Currently in our Indian setup, the data is hard to know. But there have been Western data published, even including for extreme preterm babies, what are the chances for 24, 25, 26 weeks. But now with the good perinatal team, we have been able to give good outcome for these extremely small, very low birth weight babies, less than 1 kilo babies, as well as for our extreme preterm babies, less than 28 weeks. We do regularly follow them up. We have got a good team where we involve the physiotherapist, occupational therapist. If needed, we have got the dietitian. We have got the speech and language therapist. So we have got a good team to work with. And the idea of regularly following them up is to pick up any subtle challenges what they could have and to support them. Recently in UK had a 22 plus 5 weeker, that was the lowest extreme gestational age, and I could see that child in the clinic before I came to India. So these are all very rewarding. And even here the 25 weeker 475 grams is coming back for follow-up. And it is amazing to see how these babies are doing. There are challenges, more so in the first year of life with their respiratory illness, but preparing the parents, telling them what are some of those challenges, have helped them to deal with the situations.
So once we have a good neonatal team, for obstetrician also it becomes little, more comfortable, and we are more confident.
Yes.
So less than 22 weeks, yes, nobody can do anything much about them. But after that, our confidence increases, and then we are like, okay, if something happens, we can deal with it. And we can give you still a good outcome.
Sure, yes. And involving in all these steps with the families, working, with the obstetric team very closely, we both working together along with the fetal medicine, definitely should give a better experience and the outcome for the babies and their families. Yes.
So I would urge the audience to have a visit with the obstetrician or gynecologist before they plan the pregnancy, maybe 2 to 3 months prior, so that any corrections in their lifestyle or medical history can be done prior to pregnancy only, which will go a long way in preventing any preterm labors. And I ask Dr. Manjunath if he has anything to add. So you can.
Thank you, Dr. Shefali. Preterm is relatively more common than what is aware in the society or in the community. And we as a neonatologist, we as a perinatal team are here to support you. We do appreciate that this is sometimes a difficult journey, but we are there with you to support. And more with the advancement in the perinatal care, we have been able to give more and more good outcome for our preterm babies including extreme preterm babies. So please, not to lose hope when something happens, but we are there to work with you. Okay? Thank you.
Thank you.